It's easy to think that knee pain is just part of getting older, but a few simple exercises and even a little massage trick can completely change many people's knees. So in this video, I show you 5 ways to strengthen, lubricate, and even increase the thickness of the cartilage in your knees. This first exercise helps to prevent inner knee pain, and as a bonus is great for your hips and your balance. It strengthens the outer gluteal muscles that keep your pelvis level so that your knee doesn't turn in and grind. Some people feel improvement within days after doing this exercise. Start off by priming or focusing your brain's attention on your outer gluteal muscles by facing a wall and pulling your leg to the side and slightly back 5 to 10 times on each side. Just doing this alone can reduce knee pain. Then stand on the leg of the knee that you want to reduce pain in and use the gluteal muscles on the outside of your pelvis to slowly tilt your pelvis up on the other side. Hold for a moment and then lower down. Repeat that, moving very slowly. Don't lift up with your other leg or use your back muscles to move. Focus on using your outer hip muscles to lift and lower the opposite side of your pelvis. After anywhere between 2 and 10 reps, you should start to feel a burn or fatigue in those outer hip muscles. The weaker they are, the earlier you'll feel it. The key here is to stop as soon as you start to feel that burn, even if you only manage a few reps. Don't overdo it, especially when you begin. Repeat that until light fatigue 2 times a week. Exercise 2 strengthens your thigh muscles, making stairs, getting up from a chair, and bending a lot easier on your knees. It helps stop pain in the muscles above and the tendon below your knee. Standing next to a sofa or a rail for support, put one foot half a stride back and very, very slowly lower your body straight down. Aim to keep your front shin vertical and only move down as far as feels comfortable. This doesn't have to be far at all. Hold for a few seconds at the bottom and then come up a little faster and repeat. Only lower down as far as feels good for you. It's actually okay if your knees hurt a bit. Just keep any pain to less than 3 out of 10. It should improve over time. And if your knees creak a bit, that's fine too. Repeat slowly on each leg until light fatigue 2 times a week. If the arch of your foot tends to drop in a bit as you walk, that will cause your knee to turn in too much as well. This can cause a deep ache at the front or the inner part of your knee and can really damage your knees, so we work on that next. To strengthen muscles in your calf that support your foot arch, put a folded cloth between your heels and bring your heels together, then up in a scooping motion to lift the cloth. Hold at the top for 3 to 5 seconds and repeat until light fatigue 2 times a week. This strengthens other muscles in the calves, which are good for knee support too. Your shoe choice makes a huge difference to your foot arch as well. Shoes that are stiff to rotate in the back 2/3 will help to prevent your arch from dropping, so try to stick to shoes that are stiff to twist. If you've got flat feet, consider buying shoes that are designed to support your foot arch, often called pronation support footwear, and wear them when you spend a lot of time on your feet. And if your arches are really flat, an orthotic insert in your shoe will help. Some of the knee pain that people experience over the age of 50 can come from thinning of the cartilage deep within the knee, but research now shows that you can actually thicken the cartilage that you have left. The best way to do this is by using repetitious cyclic motion. Examples of this include cycling, cross trainers, swimming, or rowing. The key here is to do these types of exercises at a moderate speed for 15 minutes a day, say 5 days a week. Keep any pain to within 3 out of 10 and include more rest days if you notice any knee swelling. After any leg workout, I always recommend loosening any tension in the outer thigh to prevent kneecap pain and rubbing at the outside of your knee. When we work our legs a lot, the muscles in our outer thigh tend to get tight, and this can drag our kneecap to the side, causing pain at the front of the knee. Most people notice this type of pain while squatting down. But a simple 30-second trick can often provide quick relief. After any leg workout, including the exercises in this video, sit on a low chair with a straight leg and your heel on the ground. Relax your thigh muscles, turn your leg in a bit, and then firmly rub on the thigh muscles in the lower half of your outer thigh with the heel of your hand for 30 to 60 seconds. If that area is really tender, it means the muscles are too tight, so you should rub them daily until it's no longer sore to do. Focus on any tender areas as you rub. This can improve pain at the front of the knee within 1 to 5 days for many people. If you only do one exercise, make sure that you do the first exercise, strengthening your outer gluteal muscles, because weak outer glute muscles are just so common over the age of 50. For a great alternative way to strengthen every muscle in that whole outer gluteal area, make sure that you watch this video next.